Welcome to the Connecticut Health Foundation's webinar on how health equity leaders are leading through the COVID-19 pandemic in Connecticut. I'm Yolanda Caldera-Durant. I am a consultant for the Connecticut Health Foundation and also a fellow alumni. And we're excited to bring you all here today to talk through these issues. And just to note that this session will be recorded, and we wanted to record it so that the fellows that weren't able to join us today due to scheduling conflicts could also see the conversation afterwards. And with that, I will turn it over to Darcey.
Hi, good morning. Thank you, Yolanda. Welcome, or good afternoon. It is 12:02. So welcome, everyone. I am Darcey Cobbs-Lomax. I'm the Director of Community Connections and Social Impact for Yale New Haven Health System. I'm excited to moderate this session with you all today. I am going to quickly introduce our two speakers. We have Maritza, who is the Director of Health for the City of New Haven. Maritza is tasked with creating a culture of wellness for the City of New Haven and strongly addressing social determinants of health, among many things that health directors do. She is a 2008 Connecticut Health Foundation Leadership Fellow. And our second speaker, or next to her, is Tekisha Everette. Tekisha joined us in the great state of Connecticut several years ago as the Executive Director of Health Equity Solutions. She brings with her a tremendous depth of experience in public policy with a focus on healthcare policy and advocacy. So please join me in welcoming both of them. So welcome. We are going to encourage you to use the chat feature today during this session. We do not have time in our tightly packed hour for each person to introduce themselves. So please chat and introduce yourself in the chat feature and share any contact information that you would like to share there. Before we begin, I'm going to turn it over to Tiffany Donaldson, who is the President and CEO now of the Connecticut Health Foundation, to welcome us. So Tiffany, take it away.
Hi, everyone. Good afternoon and welcome. I am so appreciative of seeing so many faces, and I would ask that whoever is controlling, let's put the faces back on so that we can see each other in this conversation. And we do really want to make this a conversation. To say that COVID-19 has caused unusual circumstances is truly it's an understatement. We all have dealt with COVID-19 personally, some of us from an organizational perspective, but it has impacted all of our lives in one way or another. And for some of you who have had family members that have suffered or who have passed away from COVID-19, just know that my heart goes out to you. We really wanted this conversation so that we can have a discussion around what is happening with COVID-19 around the state. And I'm so excited to hear from Maritza and Tekisha. And I really appreciate Darcey moderating. Right now, I just wanted to also, before I close, just wanted to give a brief update on how the foundation responded to COVID-19. As many organizations, we did not plan for anything like this, but as all of you know, we have known that health inequities and health disparities have persisted in our state throughout, and COVID-19 definitely illuminated some of the underlying disparities within our state and exacerbated it further. And that's why even as a state, we see that African Americans are 2.5 times more likely to get COVID and more than twice likely to die from COVID than their white counterparts. And similarly for the Hispanic community, 2 times more likely to get COVID and 1.6 times more likely to die from it. So again, the disparities that we saw before are disparities that are going to persist. So as a foundation, we knew it was time for us to respond. What we started with was understanding that basic needs were going to be top of mind. And so what we did is we created an emergency fund, and some of you on this call are recipients of that funds as organizations. And those funds were dedicated to going specifically towards organizations who could provide dollars to people for anything. It could range from food, rental assistance, diaper assistance, whatever people felt like they needed. And we dedicated $450,000 to that particular fund. We also gave dollars to the United Way of Connecticut. They have what they call their ALICE population, and this is those who are income constrained. So it's those who are working, and we know this group, and we all work for this group, and as well as those who are just above the poverty level and oftentimes doesn't receive the same social services as others. And so it's the income constrained individuals, and we gave $150,000 to support that particular fund. We know that there are still, and we will actually continue this even next year, there's so much that needs to be messaged to communities of color. When this first came out, there was a lot of need for messaging around what is COVID-19, how do we keep ourselves safe, what does it mean to social distance, to wear masks. So we actually created a fund that was dedicated to who we deemed as trusted messengers. And these are community-based organizations, because we recognize that even though the state had been working on a lot of messaging, it wasn't reaching the hard to reach populations. And it was important that those who people of color in particular trust are the ones who are providing the message. So we provided a fund of $150,000, and we gave grants out to organizations to do a lot of the messaging. I'm about to wrap it up soon because I know we need to move forward, but a couple of other areas that we funded was around telehealth and access to telemedicine. So we worked with CHC Act, and we provided dollars for them to get all of their systems up and running. Telehealth came so quickly. And also what they did is they created COVID kits for their population. And the COVID kit included thermometers and things that was needed just if somebody was diagnosed with COVID, but also gave phone cards for individuals to access telehealth. A couple of other things that we did is we supported 4CT for Connecticut, which is the large organization, philanthropic organization. They had a fund specifically dedicated to undocumented residents, which also went through the federally qualified health centers. So we supported them in that fund. We created a cross-sector collaborative, and that is up and going, and we should be having our first meeting soon with the Commissioner Gifford and other commissioners. And this collaborative is composed of community-based organizations to really talk about what COVID-19 meant on the ground and how the states did or didn't respond to community needs and what could happen going forward. And so we've created that cross-sector collaborative. And last but not least, one of the biggest investments that we made, we actually went into our endowment for this, is that we created a community health worker initiative. Maritza Bond is one of the recipients, and what we did is we dedicated over, at this point, we're actually giving more dollars to it, but $1.2 million from our endowment to fund the use of community health workers within public health departments across the state of Connecticut, particularly focusing on those communities that were most hit by COVID-19. And when I said we are expanding, again, we're trying to be responsive to the times. And New London at first wasn't on our list, and we saw that they were one of the first states to start, first areas in our state to start seeing an uptick with this second round. So, you know, we're trying to, again, be responsive and make sure that community health workers, who you all know we've been committed to, are truly a part of the COVID-19 response to help in all aspects of communication, of linking to care, and of doing all of the great work that community health workers do outside of the pandemic, but even more important with the pandemic. So that is how we have initially responded, and I'd love to hear now from our panelists on what they have been doing. And again, thank you all for joining us, and for some of you who have also been recipients of some of these grants, thank you for being our partners in getting this work done.
Wonderful. Thank you, Tiffany. So now we will hear from our two speakers, Maritza and Tekisha. And the first question that I'd like to pose to you both is, what is the current state of your work to tackle the pandemic and advance health equity, including any challenges and opportunities that you have faced? And I think either one or both of you have prepared slides, so I'll leave it up to Yolanda whose slides land on the screen first, and we'll go from there.
Do you want me to go first, Tekisha?
I'm flexible. I just asked Yolanda to be able to share my screen, but she probably has yours, so why don't you go first?
Okay. Can everyone see the screen?
can.
Good afternoon, everyone. It's such a pleasure to be in the company of the Leadership Fellows. I so greatly miss all of the different gatherings that we've had over the years, and it's really nice to be part of this panel today to talk a little bit about what's been going on. And I am so grateful for the leadership that the Connecticut Health Foundation continues, decades later, to still have a commitment around addressing health disparities and health equity efforts in our state. And thankful to be part of this effort. As you know, we've been responding to this pandemic, and as a health director for the city of New Haven, I think all public health individuals theoretically prepare and are preparing for pandemics of different natures. But really, I don't think it's been over 100 years since we've really been hit with something to this nature. And giving already the data that Tiffany just presented, and how communities in New Haven are diverse and are disproportionately already impacted in so many different ways with other underlying conditions, and having to respond to a pandemic that then exacerbated individuals' health conditions, and communities of color were impacted at a greater rate. And so one of the things that we had to do, we had nothing really in place at the health department. We had to literally had to build an infrastructure and a foundation on how to respond to this pandemic. And just really quickly, just some data points. This is where we are collectively today with the pandemic of total cases. And we also have, we also monitor the cases relatively where we are at the state level, county level, and then at the local level. What you see in front of you currently is just a response framework of where we are with the different categories, with the town alerts that the governor has placed. And that really drives indicators for us locally on where we need to really focus our efforts in mitigating the pandemic. We also utilize hospitalization indicators as another factor. Currently, we're seeing our hospitalization numbers have tripled in the last few weeks because we are, again, to Tiffany's point, in a resurgence. And so when we responded to this framework, we had to develop a dashboard. And what you see in front of you is a dashboard of what we had to create. And one of the things that I really tried to focus on is understanding the dynamics of who was testing positive and where were they testing positive, so that we can create interventions that were really health equity focused and really accessible to the community. And so what you see in front of you is sort of where our mortality rate was in our city, and the heat map in front of you is how we assessed also positive cases. And that's how we developed, for example, pop-up testing sites that were walk-up testing sites. We were one of the first cities to do that because we have a transportation insecurity in our city, and we wanted to make sure that we had accessible testing at community-driven. And so we developed testing sites throughout New Haven that were very specific and community-driven. We developed contact tracing efforts and developed an entire software program dashboard to be able to track contact tracing, because at the time the state was still not ready to roll out contact tracing, and we still wanted to try to ensure that we were isolating and quarantining individuals as much as possible. When doctors' offices decided to close their doors and emergency rooms were denying services for the community and the residents, we wanted to activate a 24-hour hotline that was managed by public health nurses and be able to be accessible to individuals and answer questions, because a lot of people really did not know where to turn and how to even get responses to questions around COVID, because it was so new to everyone. We also wanted to make sure that we were accessible 24 hours a day and make sure that basic needs were being met, and refer them to our community services division to address food and other support factors. We activated elderly calls to ensure that elderlies that live independently were being cared for and delivered food, and partnered with faith-based organizations to do so. And then lastly, we activated a social marketing campaign that really was driven from the community level up and not top down. Granted, we did do top down information. We did daily pressers on a daily basis to be transparent on our data, and wanted to make sure that the community was aware of where we were daily initially. And then we went down to 3 days, and as it progressed, we sort of modified. But we then wanted to have community influencers to also kick off mask up campaigns, spread the facts, not the virus campaigns, to ensure that we were being very cognizant of how we were communicating and messaging to our communities citywide. And so I'll leave it at that for now, and open it up to my colleague, Tekisha, who's doing a lot of phenomenal work as well.
Great. And Tekisha, and thank you, Maritza. Tekisha, when you put up your slides, can you see if you can get them to be across the entire screen? We had a request for that in the chat. Thank you again, Maritza. Thank you.
Okay, so is that the right view?
Yep, looks good.
Perfect. Okay, so yes, thank you, Maritza, for that wonderful presentation. And I do feel like we're on the Tekisha and Maritza Roadshow, or the Maritza Tekisha Roadshow. But good afternoon and welcome to everyone. Glad to be here. I'm gonna move beyond the introductory pieces about health equity solutions and just quickly state that we're a nonprofit organization located in Hartford. We have a statewide focus on advancing health equity through policy and advocacy strategies. We've been around for 60 years. I've been here 5.5, and many of you I am familiar with, have been doing work with during COVID-19, and if not during COVID-19 before. So framing the context of what I'm about to present to you, around March 10th, our office was closing for 2 days because we were getting new windows installed. And I had, 2 of us are asthmatic, and because of the disruption of materials involved in the installation of the windows, we were going to work from home. And I made a decision to say to everybody, well, since 2 of us are going to work from home, why don't everyone work from home? Within 24 hours, the news of the COVID pandemic and its impact in Connecticut started to break. And within the next 24 hours, I called all of the staff and instructed them to quickly go to the office, retrieve all the items that they possibly could, that they needed to be comfortable to work from home, because we were probably going to be working from home for at least the next month. Fast forward 7 months later, we've all been working remotely. We did do a soft, small opening with few staff being able to go back into the office, mainly because for many of you, you may have already begun to get tired, if you are working from home, of the 4 walls of your living space and or working space combined. And so we have had a couple of staff go back, but for the most part, we remain closed. During the pandemic, we have quickly, after we adjusted to that 7-month period, we really began to realize and look at the fact that we had to elevate the noise, if you will, or elevate the sound around equity and the need to understand that this pandemic is not impacting us all the same way. So yes, we are all in a global sense experiencing the pandemic, but we are not all starting at the same place. And really beginning to comment and explain that a one-size-fits-all or universalist approach to a response to the pandemic is going to further exacerbate the inequities that we see in our society. So what that resulted in is we immediately launched a new section of our website that's called COVID-19. And you can find there information that we've been collecting. And I'm going to talk a little bit about some of that information, but everything that I'm mentioning today, for the most part, you can find on that resource page. But we began to bring together information from a variety of sources that centered COVID-19, centered the communication and conversation of health equity in the context of the COVID-19 pandemic. We also immediately started an email roundup. Many of you may be getting those emails. They started off weekly. They trailed down a little bit. They went from weekly to monthly, and from monthly to now ad hoc. So they come at least once a month with information that's a synthesis of some of the items that are on the website, but it also goes a little bit deeper and alerts people to actions, activities, and things that they should know that are relevant to COVID-19 and health equity, and particularly with the Connecticut lens. Our first point of advocacy was to request from the governor's office and the Department of Public Health that the data being reported around the COVID-19 pandemic be reported by race, ethnicity, and language. We quickly noticed that we were getting that information when the pandemic, when the cases and the issues were very small, but as it engulfed and got bigger, we lost sight of getting that information. And so we immediately requested and tried to investigate what they had access to and asked for them to report. And happy to say that within days of our request, we got a response the exact same day, to be fair, and then within days of the request that has started to move forward. And we began to analyze and synthesize that information in-house. If you are anyone who's tracking the website information we get around COVID-19, you will have noticed that it is not archived. It's replaced every day. So you actually have to, if you're someone like us, and we finally transitioned this responsibility to other people who handle data more regularly. But if you're somebody like all of us who are trying to understand the long-term impact of this, you had to literally download the information at 4 o'clock, put it into an Excel file, and monitor that over time on a daily basis, which we were doing earlier as we simultaneously advocated for our data friends, CT Data Collaborative and Data Haven, to do that work. And so we've transitioned from doing it. Other points of advocacy I want to mention really quickly. We've sent over 9 letters to the governor and the DSS commissioner requesting different aspects or important issues that need to be addressed during COVID-19. 2 of those letters were sign-ons, and I just want to pause and say thank you to any of the fellows who are listening in on today that have signed on to those letters. We have done countless presentations. I can't even begin to count them right now. There's a record of them, but I can't even count them. We did do a policy priorities list, and instead of reading through this, I'm just gonna start doing the slides, because the slides actually go through the information. So we created a policy priorities list that we sent to both the governor and the legislature about what are the key priorities that needed to be taken care of in the immediate, the near term, and the long term as it relates to COVID-19 and beyond. And I want to pause here and say we really did take the position that it was our role to think about the long-term aspects of COVID-19. So we were already in recovery and response thoughts while people like Maritza and others who were on the front line were dealing with the now. We were trying to let those people do that, but think through what are the long-term implications of COVID-19 and how do we address those. We've had a ton of media, and I want to pause and thank Ariel and Liz, who we met with earlier in this year, and I think late last year and earlier in this year, and talked about some of our personal internal capacity concerns around communications. And they gave us some really great tips that we've been utilizing throughout the year, and it has pretty much tripled our earned media presence. And now we do get a lot more phone calls than we are initiating, but this is just a snippet of few of the earned media opportunities we've had, including some of the op-eds. In all of this, we are trying to lift up a couple of key issues, and the underpinning of that is the core issue that is the reason we're seeing the disproportionate impact that Tiffany mentioned in the beginning is rooted in structural and institutional racism. And we have been actively saying we need to name that, and we need to be thinking about how we address these long-term historical and contemporary issues around structural and institutional racism in the process of our response to COVID-19. While all of us have been living this. We all know that simultaneously it has not stopped throughout COVID-19, that the police brutality and murders that have happened to Ahmaud Arbery, Breonna Taylor, and George Floyd have all impacted us. And we decided as an organization to think through how do we combine the two issues that are simultaneously happening, the pandemic and the police brutality, to really call out and bring this issue to the forefront. So we entered into this effort to declare racism a public health crisis. This is not an idea that we are the first to come up with or to think about. The American Public Health Association has been talking about the relationship between racism and public health for quite some time, but we wanted to really do work to acknowledge this here in Connecticut. I'm happy to say that we have been in contact with all 169 cities and towns. That doesn't mean that all of them have acted yet. We're working daily and weekly, if you will, all the time to really move this forward. But I'm happy to say that in Connecticut, we have 18 cities and towns who have made the declaration, the newest to be Old Saybrook, which just did so 2 days ago. And we also have the distinction of having the first tribal nation in the nation to do so, with the Mashantucket Pequot tribal nation actually passing the declaration as well. This work continues, but it is not an isolated effort. We have incorporated and framed all of the work, including the declaration and the petition that we launched with over 1,000 signatures from 131 towns in the country, in Connecticut, to inform all of the information that follows on the next few pages. So we've launched a survey that we just concluded actively getting survey responses for, and we're reformatting that to get new responses that are more focused on the recovery rather than the initial issues. But we launched a survey where we worked with community-based organizations and community members. And shout out to Jen Muggio. I don't know if she's on today, but she is a fellow, and she did help us in translating that survey into Spanish and French Creole by using staff that she had or partners that she had locally to help us with that. We've issued this survey we've received, over 133 responses with a total of 528 comments. And the depth of that, just so you all are clear, it takes a lot of work to go through the qualitative aspects of this work in addition to the quantitative work. But from this, you can see we had over 31 different topics that were elevated from this work, and it is to no one's surprise. Many of the top concerns are around how do I quarantine when I don't have the ability to be, when my housing situation is not such that I can do that alone. Food insecurity has been a #1 priority, and now we're starting to see in the latter responses people being concerned about the reopening. We serve in the emergency support function in two different capacities. The ESF-6, which is the Mass Emergency Assistance and Human Services support function, as well as ESF-14, which is focused on disaster recovery. We use all of the survey responses and information that we have there and elevate that information in the context of these structures to be sure that the decisions that are being made by the governor and the governor's ESF leadership, as well as the regional leadership, are really aware of what we are hearing from the community, and we use that direct link. We have shared this information and the resources from the survey with other policymakers as well as philanthropy. And as I mentioned before, we share this information in the press. So this is just a snippet of what we have been doing. I'm 99% certain I've left out probably 30% of what we do, but I did want to provide that overview. And let me get out of stopping my screen share.
Thank you, Tekisha. I just want to do a quick check-in with Yolanda. So will we not be going to breakout rooms?
We won't be going to breakout rooms.
Okay.
We're having an issue with Zoom. So I'm trying to fix it, and that will require me to shut this down and bring us all back. So we're not going to do that.
All right.
We'll keep it, we'll do a large group Q&A.
Excellent. So to help facilitate that kind of discussion, what I'm going to ask people to do is to place any questions you have in the chat box, and we will use that to get Tekisha and Maritza's feedback. And while you do that, I do have a question for both Maritza and Tekisha. So taking a step back and thinking about your leadership learning this time, like you as a leader, what are some lessons that you learned about your leadership that you'd like to share with others? Some things that you were successful at, things that you might have, I'll use the word failed at, or have done differently. But can you both share some of your leadership learning with the fellows? And please begin to put your questions in the chat box. And whoever would like to go first.
I'm happy to start. I will say that this time has been a true test of leadership. Trying to balance the all-important role the organization has in advancing health equity in the state, while emotionally dealing with what I have been going through in relationship to the COVID-19 pandemic and the racial situation that we're in this nation, and having to lead staff through that. Oh my gosh, I'm getting a little emotional. Being very clear and honest about how I am showing up every day and not getting lost in the gravity of this work and this right now and the importance of it. So kind of keeping my self-care going, but also maintaining being there and conscious and focused for my staff and honest and true to the work has been a real test. And every day is a new day with that. There have been days, the benefit of working from home, there have been days where I'm like, I can't get up right now. Like, I just need to relax and rest and lay down a little bit longer than I usually would. But I've been working around the clock. And I think that's the other part that's really challenging with this. I'm working and living in the same place. So there's really a lack of separation there. And my work is my passion. Like, I love this work. I love what I do. So it's like breathing to me. But it's also bad when you look around and you're like, I have been in the same space on Zoom for like 12 hours. There are other rooms in this house that I need to see and can see. So what I've learned from this is that we have to embrace our challenges, no matter how introspective and clear we are about who we are. We just have to embrace that there are going to be challenges that are hard to face and hard to get over, and have the right people, places, and tools in place to take care of ourselves, because if we can't take care of ourselves, we can't take care of our people and the people who rely on us. And the second lesson that I would say that's really clear is being nimble. One of the real reasons we were able to do everything that I shared with you is the quick ability to say, there's no legislature to do legislative work too, but we still need to get work done. So how do we create pathways to engage people and to engage on the issues? And I would say that was a real big test of being nimble. And then third, never underestimating the power of the people. And I mean that both from our staff, but also from community. My staff has really picked up, shown up, stepped up. Our social media, if anybody's following it, has gone from like probably a message a month to like daily output of information. And that's really because my staff took on the responsibility of saying, we have to tell people about what's going on around health equity.
Thank you, Tekisha. Maritza?
She's so phenomenal. Thank you for your leadership, Tekisha. You know, leadership is something that you cannot take lightly. And the fact of the matter that being in this position activated me as a unified commander, and all of a sudden I had to bear the shoulders of all this decision-making for the city was certainly a heavy burden, because every decision and recommendation that I had to make was going to impact someone one way or the other. Not one group was going to be happy over the other. In fact, I'm making a decision today, this afternoon, and we'll be making some announcements, and I'm certain it's not going to have everyone liking the health director. And that's challenging when you know that people's lives are at stake. one of the things that I say often is that a case is not just a number. A case for me is someone's mother, someone's grandmother, someone's brother, someone's sister, someone's friend. And I really take every decision. I don't take it lightly, and I try to weigh as much as possible the pros and cons. And one thing that I have learned in this process is that I don't have all the information. I have to acknowledge that this is an evolving situation, and that there's going to be no perfect rollout of anything that we do, and that we have to refine. And having worked, and while people were working at home, I had no day off. I worked straight for like 56 days, 7 days a week. I was new in the city, not new because I was raised in New Haven, but I had to respond to this pandemic the day before my first day of officially being hired, and my first start dates, and it was a lot. And now that we do have an infrastructure in place, we're still being challenged because different things that we were seeing, and the challenges that I'm still facing as a leader, is being a woman of color and seeing the impact that this toll is taken on communities of color, and when we conduct this contact tracing effort, seeing that some communities of color are still not taking this pandemic seriously. They are fatigued with the COVID-19 messaging, and trying to really get creative on how we can change health behavior in a way that can turn our numbers around. Because unfortunately, when we still look at the data today, Black and brown communities are still at having a greater risk than any other, and even younger populations. And so it is challenging. I think the other lesson learned for us was, for me in particular, is looking at the elderly population and the mortality rate that we had, and wishing that there was some lessons learned that I could have sort of responded just a little quicker with interventions at the local level for the elderly population. So those are some of the challenges as a leader that I had to face, and then realizing that at the end, this pandemic is not going to go away. And to Tekisha's point about self-care, and finally having to just recognize that I have to take some time to myself to be able to continue this effort here in the city.
Great. Thank you, Maritza. Thank you both. Just to add to what Maritza said, I work for Yale New Haven Health System, and when COVID was first coming at us really quickly, I remember being on a call and someone saying, well, who is our new health director? And they were like, she's not here yet. She's coming, and they were naming you, Maritza, but that you weren't here. And then there was a response from you. And I remember thinking, like, I don't think she has begun her job yet officially, but she's here, responding and trying to help pull things together in New Haven. So thank you for your work. So to look at some of the questions that are coming in, and we would like this to be a discussion, so while you can direct your questions to Tekisha and Maritza, we would like all of the fellows really to participate in this discussion. There is something from Linda, and she has shared that she has concerns about the impact of COVID on the most adversely impacted in a granular level. So as we move into a second wave, looking at who is most at risk, the lack of PPE, access to testing, inability to quarantine, no sick leave, etc. How are we addressing that? So Maritza or Tekisha, you can respond, but if there's others, how you're working on any piece of that in your communities, please feel free to share also.
I think that's the question of the day. How are we addressing that? And I try to call to the attention of many of the folks we talk to, the important understanding that we don't all have the same privileges and luxuries in our state as others do. Yeah, I'm working from home every day, but there are people who are working in key and clear ways that they're getting exposed to the virus on a constant basis. And we have not done the work we needed to have PPE. In fact, I'm a person who has said several times, I don't think we should have had as much reopening as we have had if every single individual in the state didn't have access to PPE? And we didn't answer that question first. So we've been very much, in my opinion, and I'll say this particularly for myself, we've very much not done the work we needed to make sure that the least of us were taken care of in this process and held harmless throughout. I'm hopeful that we'll figure this out in the vaccination process, to be seen. It's going to be a struggle, and I hope that I'm not a lone voice in that body who's basically saying the first point of, we need to make sure that it is safe and effective for people to take it, but the first people who need to take it are those who are at the highest risk for exposure, not the highest risk for adverse outcomes only, because that's and I don't mean this to say that seniors and people in nursing homes should not be a focal point, but if you think about who's at risk for exposure and who could have adverse outcomes from this, to the point of morbidity, like losing their lives, then it focuses a little bit different on the strategy. So I would say, to Linda's point, I'm here with you with that concern, and I don't think we have figured out the answer yet.
May I share something with you?
Sure, yes.
With this terrible pandemic, we have also some opportunities, and we were very, very lucky to have the support of the Connecticut Health Foundation and other organizations, and for Connecticut, etc., who allow us to, for the first time, have a database of thousands of undocumented individuals in the region, including the number of members in the family, where they are living, where they get the money, what kind of job they can do, et cetera, et cetera, et cetera, because they have to come to us, or we have to go to them to distribute cards and food, gift cards and foods, et cetera. So now I think our job is gonna be in the future a little bit easier, and even for vaccinations, et cetera, we know where they are. Before we have that knowledge about documented people and some undocumented, but now we have a really amazing database that and connections and relationship with all these individuals, and that was a wonderful opportunity that we can rescue from this terrible situation.
Thank you, thank you. Tekisha, when you were giving your 3 reasons or 3 kind of lessons learned, you mentioned people, places, and tools, like having people, places, and tools in place. And so as we think of what we can do collectively as fellows, so we all went through the same or something very similar in terms of training, if you will, from the Connecticut Health Foundation over various years. What do you all think we can do together collectively to work together to impact our community? So this is open to everybody who's on my screen right now. Any suggestions on how we can work together? And I don't know if you can control your own muting or not, but it looks like I see a hand up. Dr.
Hi.
Katina, yep.
Hi, I'm Katina, fellow from 2008, I think, right? Anyways, people, places, and tools. So I have become in the Windham area politically involved, and I am now part of the Windham Board of Education. Just not less than a week ago, we distributed over 2,000 coats for our families, and also COVID packages with the thermometer, et cetera, et cetera. So there is no better place in terms of people to reach out than with schools. So I wonder if anyone else is thinking about kind of infiltrating our communities through the school systems and working with the different boards of education and institutions to provide the tools that our community, in my case, about 70%, if not 75% of our school children are of Latino origin. So that we can then promote and try to save the lives of our children and families.
I think that's a great point, Katina. I think one of the great things that I'm grateful for is that I have I report to the Board of Ed at least every 2 weeks and try to make sure that we have information exchange so that we can be able to provide information and guidance. And the superintendent and I we literally had a phone, she just texted me about something she needed, but it's important, I think, to your point, to have that relationship, because that's an opportunity to be able to infiltrate for certain. Unfortunately, in New Haven, we haven't opened up our schools. We're still distance learning. And so a lot of our communication has had to, utilize the phone line and other methods, social media and things of that nature. So it's been a little different to engage the community. But one of the things that we've done is try to, in doing our food distribution sites, we wanted to make sure we gave families thermometers, for example. So we partnered with the Board of Ed in that way to try to ensure that families had access to a thermometer.
Thank you. I think I saw two hands. I thought I saw Robin, but I see SB. Robin, did you have a question?
Yes, no, I just wanted to share when you asked that question about some of the things that we can do. And one of the things, I think Everette Highsmith is on as well, Francis. And so one of the things that we did that was part of our COVID, that I think we can also do together is that in two parts. I think that what everyone has shared, and really that is really getting the message out to people of color around, COVID-19, and also around making sure that they know where to get tested and how to get tested, and kind of helping them to do that, even with the vaccine, making sure that they have the proper information. So a project that we're all working together towards that, along with the fact that we also put together a People of Color initiative in which we went even from door to door, and we're still giving out wellness kits, which have thermometers, which has a magnet that reminds them of distancing, masks. We had mass distributions as well. And then also we gave out sanitizer and soap and those kinds of things. But I really think that we need to really, to me as fellows, come together and see how we might be able to infiltrate all areas and, throughout the state. I also think that as we have declared racism also has a public health issue, I think another thing that we can kind of come together is, really kind of holding some of the cities and towns accountable in terms of what are some of the things that they're doing in our areas, and what are some of the next steps. What should be a model for people that have declared, or cities that have declared, towns that have declared racism as a public health issue. What do they do next? What are they going to do? How will they address it? And what do we feel that maybe some of the things that will be helpful in giving them tools that they may be able to use, or where we are, that we also can implement some of those next steps.
Thank you, Robin. SB?
Yeah, I worked this entire kind of variety of projects. Not many people have read, but this was the first major healthcare event where CHWs were so badly needed and deployed. And I read a lot about New Haven doing it. Also, most of my work has been with with the Yale folks. But one of the things that has come out is the notion of a preventive public health system. This is not your healthcare system. This is a public health system using the LHDs, the local health departments. I know Russ heads up one. I guess Maritza would be too with New Haven. And looking at preventive medicine, using CHWs, monitoring, things that are really done in public health system elsewhere, outside, out in Asia and other continents. So, and very recently there was, I think some money was declared, I think it was the governor, about having things like contact tracing and things like that available for LHDs. So this is another tier that is in between the people and the healthcare system, the hospitals and so on. So I really see a growth in this layer, and how we should, as fellows, even as Connecticut Health Foundation, as an organization, participate in more development of it. It has to do with women's health. It has to obviously do with pandemics. We first talked about it about 6-7 years ago when the Ebola was out. I don't know how many people remember the Ebola epidemic, and it affected Yale because some Yale students, they went abroad, and when they came back, they got quarantined. And there were all kinds of issues, legal issues and so on. I remember studying that. It was literally 6 years ago. So
Thank you.
this system needs to be talked about and really developed further. I'd like to hear more about CHWs from Maritza. I know they New Haven used them.
And so just before Maritza chimes in, I want to pull in another piece to this, and then I think it'll tie in nicely. So there's a question in the chat from Delita, and she talks a little bit about vaccine and the resistance to vaccines and clinical trials, and that ties in with a preventative public health program and CHW. So as Maritza, as you respond about what we did with CHWs here in New Haven, if you can share any thoughts or insights on how we can encourage folks to take the vaccine, in particular populations of color, we'd love to hear your thoughts on that also.
Yeah, so those are great points. I just want to shout out Russell, my fellow local health director, who is also working so hard in responding to this pandemic. And we are doing a lot of planning actually around mass vaccination. That's actually been our focal point as well. So in addition to increasing our capacity with contact tracing through hiring community health workers and other professionals, we are also addressing the need and prioritizing the different phases of how we're going to roll out and be able to give distribute the vaccine. And so let's just start with this. We have plenty of access to testing, and we do not reach capacity because I run into people that I'm related to or communities in general, and people do not want a nasal swab up their nose. They just do not want to get tested. So imagine what we're going to do about a vaccine when we are now politicizing trials currently at the federal level, and now there's a mistrust about the vaccine that is supposed to be coming out in the near future. So it is going to be very critical for many of us on this call to be able to educate and ensure actually that before I even endorse a vaccine that's going to be launched, that it is going to be safe, because we are trusted messengers. And right now, it is my hope that we can level out the unfortunate situation that we have at the public health level, at the federal level, where we are politicizing public health and the way we're addressing this pandemic, which is causing a lot of mistrust and people thinking even to the fact that COVID-19 is a hoax. And so it impacts them personally. So there's a lot of work to be done. I'm grateful that we will be launching our community health workers relatively soon, so that we can be able to create messaging, but we also need to make sure that that is backed up with true science.
Thank you, Maritza. So Russell, not to put you on the spot, but is there anything you'd like to also add as a health director? And can you tell us what town or municipality you're with, for those who don't know, including me?
Sure, yeah. I'm the director of Chatham Health District, which is a rural suburban health district in eastern Connecticut, East Hampton, East Haddam, Portland, Colchester, Hebron, and Marlborough, the municipalities in the district. And I'll say a couple of things. One is the pandemic has exacerbated not only health inequities in a really, really dramatic way, but it's also underscored the degree to which our public health infrastructure has been crumbling for so long that when the need arose to stand up response, I think it's been inadequate. So, I understand exactly what Maritza's saying about self-care for health directors, and probably anybody else, Tekisha, you included, is important. There's perhaps one thing that I've seen so far that gives me a little bit of hope, and that is that the state, when they came forward with support for things like contact tracing and vaccine clinic planning and things like that through a cooperative agreement called the ELC, Epidemiology and Laboratory Capacity Funding, that when they decided to distribute that money to local health departments, the first way they thought about doing it was with a straight per capita factor. So they had $20 million divided by population and give it to everybody. And in the end, they also modified that using a poverty factor. So parts of the state, local health departments that serve primarily low-income populations got a larger share proportionate to their population than did other health departments. And I think that was exactly the right move, although in the end it really served to cut about 25% of the funding that my district would have gotten just if it was straight per capita. I think it was absolutely the right thing to do, to understand that the pandemic is not striking every part of the state the same way. And so that gave me a little bit of hope. I'll also say and call out Reverend Anderson as being a Connecticut Health Foundation fellow that is on the state of Connecticut's vaccine work group. So Reverend Anderson, we're all pulling for you, and I know you're going to bring that that lens of health equity to the state's vaccine distribution planning. I don't have really any brilliant ideas for how to build trust with vulnerable populations when it comes to the delivery of the vaccine right now, when from my perspective, it seems like there's only been a larger deficit in trust that's been created as a result of the pandemic, which is really, really unfortunate. The timing of our current political discourse and the pandemic could not have been worse. It really could not have been worse. I wish I had some brilliant ideas, but we've all got our work cut out for us in terms of getting that vaccine out, building that trust, and I'll stop rambling there.
Great. Well, thank you, Russell, for letting me put you on the spot. We have about 3 minutes left, and there was a question that I think is really important that we may not really get to delve into today, but I think is of interest to the Connecticut Health Foundation. And I wanted to just give Linda the space to voice her question on race and ethnicity data, what is being collected, what isn't. And part of this initial webinar is to kind of spur us on to have more conversations. So this may even be a launching board into another kind of webinar or lunch and learn. So Linda, would you like to share your question? So I'm just not reading it off the screen, and you can kind of share your thoughts on that.
Thank you. I actually just taught this in a class with the medical students when we're talking about, because, you know, we're always talking about system change. What are we going to do with this data? And you know, so I did my background, and I found out it's not being consistently collected in a standardized way so you can compare apples to apples. So if you get tested at CVS, are they getting the same data that they're getting at when you go through a drive-in? And then also, even the way the federal government is asking the data to be reported because of politicization, it's not being standardized. And then I think to the leader's point, the community doesn't know this data. They know anecdotal, but we're not messaging it. And so when you put that all together, how do we turn around and say, oh, let's get vaccinated, right? And I heard someone say, we're the last to be tested, so we're going to be the first to be vaccinated. Nah, that's not happening. So I just feel like, you know, getting that data is not like how we get it, what do we do with it, and how can we empower both communities, us as advocates, and hold the feet to the fire. And also lastly, I'm sorry, what are we getting data on? People are focusing on testing and infection rate. We're not talking about hospitalization. We're not talking about, you know, comorbidities. We're not talking about, long-term impact. I think when we talk about the data, we need to be very specific of long-term metrics, because the impact of this disease is going to be beyond the acute phase.
Thank you, Linda. And so we are going to have to wrap up this session, but I want to thank Maritza and Tekisha. I'm looking around my screen, that's why my eyes are going 8 different ways. Thank you both for being our presenters today. Thank you, fellows, for coming out. You will get a brief survey that we would love for each of you to fill out. And that's going to help us think about what we can do collectively further. And if these types of convenings or coming together are helpful, we would love to hear from you. So please complete that. The slides, the participant list, and the recording will be available to everyone, whether they attended today or not. And then if when you can't sleep at night, have an idea of something you think would be great for us to work on together, or idea for another webinar, please send it to me or to Tiffany or Yolanda or someone, you know, and we'll try to help make sure
And
that
to Yolanda.
Yolanda, thank you. Thank you, Yolanda. And we'll try to make sure that we can bring you all back together again. Thank you all for all the hard work you're doing in your communities. And we look forward to seeing you again soon. All right.
Thanks, everybody. Be well, be safe.
Likewise. Bye.
Bye-bye.
Bye.